Hello, good morning. Good morning to everybody joining in Zoom and also the YouTube live stream viewers of this webinar on the relationship between health and the environment. This webinar is organized by the Clingendael Institute with support of Cordate, KNCV, TBC and the AIDS Fonds. My name is Louise van Schaik. I'm head of unit at the Clingendael Institute, and the Dutch and EU role in global health is one of the fields of my expertise. I will be the moderator of today's webinar. So today we will be discussing the relationship between health and the environment. The virus that causes COVID-19 is likely to have originated from animals and spilled over to humans. My 9-year-old son is always complaining about the Chinese eating animals they should perhaps not eat, but I think that's probably a little bit too simplistic. Many other zoonotics emerging diseases are likely to increase the frequency as a result of human behavior. So consider, for instance, deforestation and large-scale animal farming. They are just two examples of human exploitation of nature that accelerate the development and spread of new diseases. Climate change further aggravates the spread and prevalence of zoonotic diseases. So two concepts take a central position when discussing this relationship between health and the environment. Perhaps it's good to just quickly clarify what is meant with them. So they are One Health and Planetary Health. The One Health perspective underlines how human, animal, and environmental health are interrelated. As I mentioned, in a country like the Netherlands with a highly intensive animal farming industry, this is fully recognized. For instance, we have a strong policy on antimicrobial resistance, AMR, and have brought back strongly the use of antibiotics in livestock to avoid, let's say, new diseases to emerge. One Health is then therefore also expected to be continued as a key perspective in the global health strategy that is expected to see the light of the day in the autumn. So the Netherlands is working on such a global health strategy. And by the way, simultaneously, also in Europe, a new global health strategy is developed. Then the other big concept in this space is the concept of planetary health. According to this approach, human health is dependent on the Earth's ecosystem and social well-being. The transgression of planetary ecological boundaries, as well as the shortfalls in social foundations in many contexts, have detrimental impact on human health. Issues such as heat waves and rising sea levels as a result of climate change are an example of this. At the same time, up to 40% of the world population still has no access to social health protection. So universal health coverage is still not something we have today. To talk about these concepts and what they mean for global health policy, and if considered from different perspectives, we will, well, let's say, pick the brains, listen to, learn from an excellent panel of speakers. It consists of, first of all, Ron Fouchier. He is the deputy head of the Erasmus MC Department of Virosciences. So this is really the center that covers the pandemic and also the emergence of new infectious diseases here in the Netherlands. Then we are joined with Ama Pokuaa Fenny. She's a senior research fellow at the University of Ghana and West Africa, Global Health Leaders Fellow at the Chatham House Institute in London, an institute with whom we as Clingendael cooperate a lot. And finally, we have Remco van der Pas. He's an associate fellow here at the Clingendael Institute, but he has recently also joined the Center for Planetary Health Policy in Berlin as a senior research fellow. So Remco has worked for years on global health, and he's also a doctor as training, a medical doctor, but he also has a PhD in global health and is now spreading his expertise to the relationship with the environment. He is also associated to the Institute of Tropical Medicine in Antwerp. So this is the second of the series of online global health webinars of this year. And we will really look at this multi-sectoral global health strategy. And we also try to contextualize ongoing international debates and see what they mean for the Netherlands. Our objective is also to really engage with you, with the audience, before entering into a conversation with the experts. So during these webinars, we have opened the chat and you can also post questions in the Q&A. My colleague Vera Kranenburg is moderating the Q&A and she's looking at the questions. So please, if you post them, also indicate to whom you would like to address them. And she will then try to intervene in the debate when possible, and in any case after the first conversations. Since last webinar we had too little time for the Q&A. This time we added 30 minutes extra and we have 3 speakers. So we hope that there will be a bit more time and possibility for the interaction. And should this not emerge, then we can also stop a little bit earlier because everybody is busy these days after the COVID pandemic. Although we were discussing just ahead of this webinar whether we can really talk about that because the numbers are again so high and we are in the midst of the summer wave that people don't really talk about anymore as much as we did before. For now, I would like to pose 2 questions to you through the poll function of Zoom. So let's see if we can upload the first question. The first question is to focus on this interconnection between human health and ecological well-being, so this planetary health concept. How do you consider that? Is that really something that gained prominence in Western Europe but is less relevant for low-income countries? That it should be a central feature of any global health strategy? Or perhaps that it provides the entry point for preventing future pandemics. If you care about the environment and nature, then you can prevent maybe future pandemics. Or does something else come to your mind when you think about this relationship between human health and ecological well-being? And I wanted to ask people, please use also the chat if you choose for this category other. So maybe then we can learn, let's say, what you have in mind when discussing human health, the relationship between human health and ecological well-being. Please, let's use a little bit of time for the voting. All right, let's see, my colleagues at Clingendael. Joris, do we already have a result? Wow, most people say it should be a central feature of any global health strategy. And nobody says this is really something for us in Western Europe, but it's not so relevant in the rest of the world. That's really super interesting. Let's see also if we have somebody. I see that Nora van Gaal added in the chat, it should be a central feature of any global health strategy, but it's not only health related. So it's not only something only health specialists should care about. And I think that's also linked to a second question we had in mind. And that's also the final poll question. So the challenge of combating climate change and preserving biodiversity is so big that public health policies should leave that to others. It's maybe a bit too big for the medical sector. That should just focus on diseases. But climate change and biodiversity, that's more for others. Do you agree? Do you? Yeah, I don't agree, or I don't know. And also, if you have something else to say about this, please don't hesitate to type it into the chat. So is this really something for the global health community, or climate change, biodiversity challenge? It's so fundamental for our planet and it's already being discussed in other circles. They should tackle it. All right. Joris, do we already have a result? Most people don't agree. So we see that most people say, well, there is also a role for the medical sector here, for the global health specialists to consider this relationship clearly. But also 5 people say, well, I'm not sure. Maybe it's other, environmentalists, foreign policy people, economists that should perhaps take the lead here. If somebody would like to add in the chat, I know that if you watch this through YouTube, you can't watch the ads to the chat, but if you join through Zoom, if you want to clarify your position, don't hesitate to do so. All right. All right, thanks. So that were the questions to you. Let's move on. Remco, since you've really joined an institute for planetary health policy research established in Berlin, we're always a bit jealous about the amount of think tanks and research centers that are established in Germany and in Berlin, and that there's so much going on and so much intellectual capacity in this city. And fortunately, you're also an associate fellow at Clingendael, so we can, let's say, tap into that. I wanted to ask how you have answered the poll questions, and also if you can elaborate a bit more on what is your take on the relevance of the planetary health agenda. So how, why did you join this center, and why did you decide to, with your global health background, to focus on this topic? Please, Remco.
Yes, and that's a relevant one. Also, why the planetary health discourse is now much more prominent on the agenda than, let's say, 10 or 20 years ago. So I think it's quite central, and I think public health and health people should give much more consideration to it. As a public health professional myself, working on international health matters, it's always looking at the healthcare system, how that is picked up in society, how that relates to health inequities. We always somehow took that separate from the environment and environmental issues. There's of course the environmental health work that people are working on, but they were somehow a bit disconnected. That's also how we organize our healthcare system. And the planetary health thinking basically says, well, humans can only live healthy when also the planet as a whole, as an ecosystem, is healthy. And the ecological degradation that we see at the moment happening, not only vis-a-vis climate change, but also biodiversity loss or chemical pollutants that are in the atmosphere, we need to bring those much closer together. And that's why there was a Planetary Health Commission started about 5 years ago by the Lancet, supported then by the Rockefeller Foundation, and that really has put it on the agenda that we, in essence, we need to start looking at the ecological boundaries, the planetary boundaries as they call them, and how we also in the developed countries should respect them, because if we don't, and look at the nitrogen debate in the Netherlands, then we be at risk also for future health impacts. And at the same time, in many places, there is still the basics, the health protection, education, care missing. And to bring those together and to formulate what that would mean for a policy agenda, that's what planetary health is trying to aim for. And I can talk a little bit later what that would entail.
Okay, thank you so much. So first shot, this is an important issue. Examples are chemicals, but also the nitrogen and nature relationship, climate change, the local pollution, all these environmental conditions have a huge impact on also public health questions. And this is why you decided to go into that, and why also New Thought leadership on this issue was established through your institute in Berlin. Yeah, thanks. So that's very good to know. I would like to move now to Ama Pokuaa. Fenny, you mentioned that you have been very busy in the past year as a commissioner of the COVID-19 pandemic response group in Africa. We are very curious to hear from you how this issue is looked upon in Sub-Saharan Africa, West Africa. You are from Ghana. So in this region where you know the health systems and policies very well, how is planetary health relevant, and the One Health approach that is linked to it. Please, Emma, give you the floor.
Thank you so much, Louise. I'd like to say that when I looked at the poll results, and I realized that everybody didn't think that it was relevant in the low middle income countries. That is really not the case. I mean, these issues are very much at the forefront of what we are doing now, because we continue to see the link between human health and animal health, and also environmental health. And there are several initiatives in Africa that actually look at how to make sure that we encourage collaboration across these different sectors. So, for example, I just want to make note of the fact that we have several collaborative projects in Africa. There's one in Chad, for example, that looks at joint livestock and child vaccination campaigns in some of the communities where they pasture a lot of livestock, across Africa. There are several collaborations. The One Health approach is very much at the forefront of so many external funding as well. So this is a problem for us. This is a challenge for us. And personally, as a health economist, I know that we've seen what COVID has done. COVID has shown us that health is linked to our economic production, and you cannot hide away from the fact that we are very much a part of the ecosystem. And so really these are issues. And then we have the monkeypox that is also showing up in several countries in Africa that hadn't seen these cases before. So we continue to see the effects of, our environment, human health, also animal health, coming together to create a scenery that you cannot run away from. And so these are very relevant issues we are dealing with, and we continue to find ways to partner with other institutions to solve some of these problems across Africa. Thank you so much, Louise.
Yeah, thank you. I was gathering yesterday evening with some global health policymakers and specialists in a dinner in The Hague. And we were also talking about the great amount of expertise that nowadays exists across Africa in several research centers, and also the cooperation between researchers in Europe and Africa, and also, of course, the example of the fantastic systems in South Africa for detecting the Omicron so early. And then they were even punished for that because everybody closed the borders, and how to avoid such situations. But also the handling, of course, of the pandemic, where the lockdowns were sometimes better executed in Africa than they were. But I think it's super important also that you point out this relationship between, basically, if you mess up the environment, there's a higher risk of diseases, and the fact that you have diseases is bad in itself, but it can also have, in the case of pandemics, devastating impacts on the economy and the whole societal systems in countries. You can see whole societies basically collapse. That's what we really witnessed with COVID, and also in combination with the high food prices that we see nowadays, and the cost of living crisis more generally. This is really dramatic. So that's that all these things are related makes it very big, but it also doesn't. It's also not an excuse not to do something about it if it's so big, because we have to. We don't have another choice. Yeah, thanks. So we will get back to that. I'm sure of that. Well, in the meantime, I also saw in the chat that people say, well, this is very important to look at, and also Kazia Lemanska mentioned that there is a consultation ongoing on the EU Global Health Strategy. So for those of you interested in this, you can contribute to that. And of course, it would be important that also this topic of planetary health and One Health is included there. That brings me to our next speaker panelist, Ron Fouchier. You work at the institute in Rotterdam that is looking into the development of new infectious diseases. And you work closely together with Professor Marion Koopmans, who has been on television a lot during the pandemic. She was really our COVID expert. She was also in the committee that visited China to look into the emergence of the COVID-19 disease. And she also mentioned very often the new risks for zoonosis, and sometimes she had these lists with all kinds of new diseases that constantly apparently pop up in the world, and we only learn about when they really turn into epidemic and then could become a pandemic, like happened with COVID, but now also seems to be happening with the monkeypox. So my question to you is also really, how do you look at COVID in relation to environmental pressures? And also I noticed that you are a key expert on the issue of bird flu, and that's, I think, also a prominent example, you know, of the birds flying through the skies, and we then lock up our, let's say, chicken and poultry here in the Netherlands, but it's very difficult to address. What do you think, like a country like the Netherlands could do to address this issue? So what should be definitely included in this forthcoming global health strategy on this issue? Please, Ron, the floor is yours.
Yes, thank you. Yeah, so where Marion Koopmans has really been the expert on COVID, I've been continuing to do work on bird flu, which, as you may know, is still a problem today, also in the Netherlands. So influenza viruses of humans originate from birds, and those birds naturally carry, wild birds naturally carry influenza viruses all the time. And it's really not a problem. These viruses have co-evolved with birds for thousands and thousands of years. But sometimes they spill over into poultry, and then they can evolve. They can become highly pathogenic variants, so variants that kill poultry really quick. And what has happened now is that in Asia, these highly pathogenic viruses of poultry have spilled back into wild birds and are now being transferred by bird migration all across the Eastern Hemisphere into Northern Europe at the moment. And these viruses are now causing problems also in our poultry sector. So they were first confined to Asia, but are now in Europe everywhere, and also in Africa. They've recently spread from Europe to North America. And so this is really exemplary of the One Health issues. So it is the connectedness between wild animals and domestic animals, domestic poultry with domestic mammals. It is now spreading over to domestic poultry, and then subsequently also via wild birds to wild mammals, to foxes, to seals, to polecats in our country. And so it's really exemplary of the One Health problems, the planetary health issues, because the fear is that at some point in time, these viruses may evolve also to become human health threats again. And so the Netherlands is one of these countries with an incredibly dense veterinary sector, which I think we produce more than 100 million chickens, more than 12 million pigs. And these animals are also host to influenza virus. And at the same time, we're having 17 million people on this small piece of land. And so we are considered one of the hotspots for zoonotic events to happen. And we see these spillovers in the Netherlands all the time of viruses from wild birds into poultry. That's why we're now having this shielding off of our poultry from wild birds. And so what Netherlands should be doing is really to keep the domestic animals away from wild animals. We should be proud of having so many wild animals in our wetlands, migratory ducks, geese, swans, gulls. We have many species of bird that migrate through the Netherlands. We should be proud of that, but that means that our poultry sector should be taking this into account. We should not have poultry farms right in the middle of our wild conservation areas where migratory birds come in with hundreds of thousands of individuals in the winter. We should also limit the densities of some of these poultry populations, because once a spark ends up in a poultry farm, it's close to impossible to stop it if the area of poultry farms is too dense. And so I think one of the things that the Netherlands should be doing is, of course, keep their biosecurity in order so that the poultry is protected from spillovers from wild animals. But at the same time, try to reorganize or organize the sector on the whole so that you have a sustainable system of farming where wild and domestic animals do not interfere with one another. So we should not affect wild animals by poultry, and we should not have poultry be affected by wild animals. These are very easy things that the Netherlands should be doing. There's some short-term solutions, and increasing biosecurity, maybe consider vaccination. And there's a long-term strategy of trying to have a sustainable sector on the whole.
All right, thank you so much, Ron. And super interesting what you're saying, that actually, let's say the poultry farming being close to nature areas where a lot of the wild animals are living is also an important factor to take into consideration. I also wonder, because I've heard that several times, in policy and expert debates, about, let's say, the Netherlands being really a hotspot where new zoonotic diseases might emerge, whether people are aware of this, because I think the general public, looks at other places on the earth where new diseases might come from, and is not considering probably the Netherlands, because we always think that we are so well organized and such a clean and organized country, whereas the risks are quite high, and if this would happen, that would also be super damaging for our own economy, but also our international positioning, of course. I see also in the chat there's already a question, and I think that's to you, Ron, so maybe we can address it immediately. In relation to planetary health, should the number of livestock in the Netherlands and on our planets not be reduced? This is Inge Bermento asking this question. Not an easy one, certainly not in these times. But how do you look into that from really a health perspective?
Yeah, I think that this is not just a matter of opinion. I think it's clear that if we would globally consume the amount of meat and animal products that we do in the Netherlands and infer same consumption rates in the future for the global population of now 7 or 8 billion people, it's simply not sustainable. And so there is no doubt that we need to change consumption patterns of the people in the West to reduce the consumption of animals and animal products, because it's simply not a sustainable consumption pattern. And so we really need to move towards more plant-based food products. Mm-hmm. See, that for the Netherlands, we can produce enough meat and eggs and milk to consume, but if we would translate this consumption pattern to the global population, it's still simply not sustainable. We cannot produce it because the cost effectiveness of producing meat and animal products is simply much higher than producing plant-based products.
Yeah. Wow. Well, in this respect, it's also very important, I think, to mention that in the Netherlands, there is a huge development also to develop alternatives to meat, plant-based alternatives, and this is really a newly growing industry that's making headway. So that's also perhaps a positive development in the Netherlands going on in that respect. Let's move back to you, Remco, because I'm very much interested to hear also how this debate is taking place in Germany. So you are Dutch, but you are based in Berlin. And in Germany, I said already, we're jealous that they have so many top-notch research institutes and think tanks, but they've also been very proactive in the past years on global health. They have more or less, saved the World Health Organization when it was under pressure by the Sino-US fight. Germany for years is very prominent in global health debates, and now this new institute on planetary health. Is that meaning that this is already recognized, or is it more meant to fill a void because it was not yet so much recognized? So how should I look at it, and what is the German perspective on this issue?
Yeah, this is, I don't know if I can talk about the German perspective, being a Dutchman in Berlin, but it's to fill a void, I would say, because it was not yet recognized, and now we start working on it. Germany has become quite active in the multilateral arena, also vis-a-vis pandemic preparedness, the One Health approach, how they support the WHO, and that finance is related to that. I think the planetary health angle to it is to say that we need to take a broader consideration also with other sectors to reduce risks for instance, if climate change will continue as it is, there will be a much higher risk for pandemics. If we keep on organizing our agro-farming the way it does, we have a higher risk also for infectious diseases and zoonoses. So this angle is being brought into it. We are the center in Berlin is hosted by the German Alliance on Climate and Health. That alliance looks more to how healthcare is organized, and that it should be much more CO2 neutral in the way and sustainable how it does things, because the healthcare sector itself is up to 4 to 8% of greenhouse gas emissions. So there's gains to be made there. Huh? Think about it, how in hospital settings, a lot of plastic and a lot of waste is being generated. So that's one focus point. But our policy angle to things is really about sustainability and how to get there. The health sector vis-a-vis other sectors. In Germany, the whole energy debate and transition is very important, of course. Now, also in relation to the dependence of Russian gas, what will be the health impacts of that? So that's one way of looking at it. But more importantly, where my work is coming in is it's the thinking on the limits to growth, whereby basically the notion is we can't, from a sustainability perspective, in aggregate, consume and produce the way we did before. There are limits to what we can economically pursue, especially if we measure it in GDP growth, etc. So if we want to transform to a well-being economy, then it means also that we really need to rethink our economic priorities. And especially if in lower income countries, there should still be the space with the carbon budgets to grow, and also to have a domestic economy that finances basic health protection and education, etc. So there's a whole debate about shared responsibilities, which mimics quite a lot also the debate on how to deal with climate change, but then from a health angle. And I think that way of looking at it, and also basically arguing for a steady state economy, or what Kate Raworth calls the donut economy lens of looking at things, and then trying to find out what that means for health. That's what we're trying to do in Berlin. But yes, this is it's not just tinkering or doing things just different. It's really it's transformational. It's a different way of organizing sectors, and that's why it's a long haul. It's not something that will be attained next month. Over.
All right, thank you. So it's a systemic issue. It's a long-term issue. I think it's also fascinating to say you always think about the relationship between environmental deterioration and then the impacts on global health, so climate change, pollution, chemicals, etc. But also the energy transition as such. If people are going to be in the cold and you are, for instance, rheumatic, then you might also have health health issues related maybe to the energy transition. Although I think on the whole, let's say us becoming more energy efficient and switching quicker to renewables will be good for the health situation. But the reopening of coal plants, of course, works the other way around. So there's also this relationship. I see in the chat Tobias Rinke de Wit, who's posted an article in Nature. And also Jerome Lok has a question. Vera, I wanted to ask you to already look into that and maybe also look into the Nature article, maybe try to summarize it. But then I'll first continue with the conversation with the speakers, and then I will get to you, Vera. Yes, and my next question is actually to Ama. From Ghana in Africa, always the debate, in global health, like, is the relationship between the Netherlands and the EU, European countries and Africa, is it a kind of donor-recipient relationship in the field of global health, or is it an issue of animosity? Africa being angry about the patent issues in the COVID vaccines, and the Western countries buying all the vaccines initially. Whereas, as I already indicated, the own effort in the pandemic was quite good. The Europe had really troubles with overflown hospitals and not excellent response systems to the pandemic. How do you look at a country like the Netherlands? What can be our contribution also if you consider this issue and this agenda at the international level? And also, do you see a link with the ongoing debates on pandemic preparedness and possible new pandemic instruments? So how is this related to early detection of new diseases? How do we know that diseases emerge in animals? And how do we know if they are likely to spread to people? Do we have enough expertise on that? And can you say a few more words about that, please,
Okay.
Ama?
Yeah, thank you so much, Louise, and thank you for raising these issues. I will take you back to when the COVID pandemic started and all the issues that surrounded the inequalities that we saw in access to vaccines. And the sad part is that now some of the vaccines are being destroyed because they've been expired. And so you just wonder why all of that happened. But it goes to show that when there's a very big problem, countries become more inward looking and everybody just wants to survive. So it's a natural instinct to protect your own. And we saw it happen all over the world. So we are learning from these mistakes. And here in Africa, we are trying, especially with the COVID response commission that we're working on, to engage all the expertise we can on the continent, to see where there are lapses, to see where we can also collaborate, especially with Europe. And we have a lot of institutions that are collaborating in research, and also to sort of bring together some form of funding for preparing for the next pandemic. We realize that whatever happens to us in Africa affects the rest of the world. We cannot live in silos. And so there's always this push to work together with everybody across the world. It doesn't matter whether it's a country in Asia, a country in Europe, a country in America. We need to be on board together to ensure that the next pandemic will not take us by surprises. We have learned our mistakes. Again, when it comes to zoonotic diseases, there are so many sentiments around wildlife, the engagements of humans with wildlife, traditions, culture, how society even views wildlife and its role in health. So there's a lot of reconditioning, and we have a lot to learn from each other. So I can say that collaboration is key. The Netherlands has a lot of expertise around livestock, and human health that it can share with the rest of the world. When you see the problems that can come out of the situation, I think you're quick to learn and share the solution with the rest of the world. So really, the Netherlands is placed at that point where it can share its solutions with the rest of the world, because it can see what can happen with disengagement between the livestock and human environments. We can see it happening. It will explode if we don't do anything about it. And I'm sure that we can learn from the expertise from the Netherlands. We also want to try and collaborate, because we have to avoid the harmful impact of our activities. So whether it's public policies in health, whether it's public policies in the transport sector, whichever sector, we really have to find a way of working together as a whole society. And again, we can all learn from how the Netherlands is doing this. Thank you.
All right, thank you so much. And I think also we have more prominent people active in the World Health Organization, in the discussions on the instrument for pandemic preparedness. I guess, the One Health approach in particular, the Netherlands has been a front runner already for years. And we can also share our experience, and maybe also Ron has more to add on that issue. Ron Fouchier, I actually also wanted to get back to you, and I think some of the questions, especially the question on trade that was posed, is relevant for you. So I wanted to actually bring in Vera, but I also wanted to ask you first another question, which is, what type of diseases do you see looming at the horizon when environmental degradation is not being halted? You already talked about influenza viruses, and I know also that in the European context before COVID, that was always the scenario, a big flu outbreak, basically, if I say it correctly. And also I wondered, are you looking at the Netherlands, at Brussels, at Geneva, or elsewhere to tackle this issue? So where should we start with the response of scanning, let's say, the emerging of new diseases, early detection, and also early action to combat them? So then maybe it's a good idea if I first go to Vera and then to Ron. Vera. Hi.
Yes, we have, I think, two questions. One that is related to the one that you just talked about. Yeah. That was on the Nature paper, because the big conclusion there is that they find that ecological transition is already underway, that even if we keep global warming under 2 degrees Celsius, it will not reduce future viral sharing. So they say we need to pair viral surveillance with biodiversity surveys. So where are species going? So this is related to early action, early response. So in that sense, there was the question or the comment on this paper, what your view is on this.
Yeah,
and should
of course, if you know it,
if you know it. Yes. Yeah. And should I pose the question on trade also?
Yeah, I think that would be.
Yeah. So the other question is, of course, on that the Netherlands exports vast amount of animal products to other markets. So the question is, what is the role of trade here, Dutch trade specifically, with regard to the points that you raised earlier on wild animals mixing with domestic animals and vice versa?
Yeah. Wow, Ron, I hope we don't overburden you. And otherwise Tobias, he has been also speaker in one of the global health webinars, focusing on the digital dimension of global health, but also many other issues, and being based in the Amsterdam Center for Global Health. So he poses a question to Rotterdam, basically. How do you look at these issues, Ron? Please, the floor is yours.
Yeah, so the first question from Pinky DeWitt is about the Nature publication, which shows that due to climate change, global warming, there's going to be more mixing of wild animals increasing the risk of spillover between wild animals, but subsequently also to domestic animals and humans. Now, this is a paper specifically modeling the impact of climate change, but we know that also destruction of ecosystems for other reasons, like deforestation, has the same effect, is that you bring wild animals in conditions and densities that are not natural, and that can result in spillover of viruses between different species and adaptation of these viruses to new species. And if you also then change the conditions between the wild and domestic animals, so the interface, which of course then also happens, then you might see those outbreaks occurring also in domestic animals and subsequently in humans. And so this is a well-known problem. And it is also a well-known problem in the Netherlands with all these incredibly high densities. Now, that connects to the question about trade. So the Netherlands has a high density of animals because we are very efficient, as you just pointed out, Louise, in a number of things, and very cost efficient. And so it's a market of that's really driving this trade. The trade in this case goes to Germany and the Netherlands, so it's really only regional, well, mostly regional trade. And it's simply based on market conditions. So we produce animals that the Germans want to buy, or the Belgians or the Russians, whoever. And but the animals need to be produced somewhere. So if the Netherlands stops producing pigs or poultry, then other countries will take that market over. So I don't think that stopping trade is the answer to the problem. We really need to change consumption patterns in the long run, and to change the way we farm animals, not where we farm animals, well, of course, in relation to wild animals for sure, but mostly how we farm these animals and how many, what densities. I think that's more important. Now, with respect to the question about my crystal ball about predicting what's going to happen next, which are the next viruses, is always very, very difficult. And of course, respiratory viruses, we know, are always high on the list. We've seen how easy it was for COVID to spread globally. So
for the non-health specialist, respiratory viruses, meaning?
So the viruses that cause an airway infection and can be transmitted by coughing or sneezing or droplets or contact of our saliva. Those we refer to as respiratory viruses. They replicate in our nose, throat, lungs, and those transmit relatively easy. We've seen that in 2009 with the flu coming out of Mexico, South America, but again now with COVID. But we've also seen a pandemic of HIV/AIDS this century, which spreads very, very differently, but still it's an incredibly severe pandemic. People forget that this is a pandemic too. This is a virus spilling over from wild animals into humans and spreading through blood-blood contact. We are now facing a problem with monkeypox, which is not a pandemic, but there is a small chance that it will develop into one. There's always that risk. And so it's very difficult to predict. I think the frequency of pandemics is highest with respiratory viruses like the flu or COVID, but we cannot ignore the fact that other virus families also can spread. Now, with respect to the question, where am I looking at? Am I looking at national government or the EU? Am I looking at health sector or the agriculture sector? And I think the answer from a One Health and Planetary Health perspective is that we need to look at everybody, right? So the COVID spread out of Asia, HIV spread out of Africa, there are pathogens spreading out of North America or Europe. And so these pandemics can be sparked anywhere. They can come from many different species. And so this is a global problem. It's a One Health problem. And it is a problem of all sectors because it starts in wildlife. These viruses are zoonotic. They are constantly circulating in wildlife. There's nothing we can do about that. That's nature. These viruses can then spill over into domestic animals. And so the agriculture sector globally guided by organizations like the FAO, the World Agriculture Organization, have a task to limit this spillover, to detect outbreaks quickly, to clear the outbreaks if they can. And that's their responsibility. But the health sector has the same responsibility, because you cannot prevent everything from happening. And so also the health sector needs to be on the lookout for new infections arising. So we should have early warning systems, and we should try to prevent pandemics by monitoring the interface between animals and humans and stopping outbreaks early. At the same time, it's also unlikely that we will be able to prevent every pandemic. And so we should also prepare in the health sectors how to respond to them. We've now seen how devastating a pandemic can be. People were starting to be relaxed because of the 2009 pandemic being relatively mild. Now we've seen again how devastating a pandemic can be and how important it is to prepare for them. And so I think the health sector, the agriculture sector, nationally, Europe-wide, globally, all play a role, and the citizens play a role, right? I pointed out that it has to start also by a balanced dietary consumption, a balanced consumption pattern that's actually in line with the capacity of our globe.
Mm-hmm. Okay.
And so it's a complex problem, a lot of global health strategy work to be done.
Yeah. Well, for this webinar, we were also considering, whom could we invite from policy circles? But we found it a bit difficult to identify, and that's always the tricky issue with these multi-sectoral issues. Who in the end is responsible? Because I was starting the question, should we look to The Hague, Brussels, or Geneva? But actually, you say, well, Rome, the FAO, is also important to keep into account. I see a lot of questions coming in, especially through the chat. But I also wanted to ask Emma or Remco, is there something you want to respond to of what Ron has just brought to the fore, brought to the table? Let's quickly look at both of you. Yeah, I see Remco is unmuted. So Remco, maybe first, and then Emma, maybe raise your hand if you would also like to intervene.
Yeah, if Emma would like to speak, feel very free also.
No, please go ahead. I think my internet dropped, so I missed the question. So please go ahead.
Okay.
Yeah, please.
Well, so there are new pandemic risks. There's uncertainties there. Scientists like Ron and others are rightfully looking with a large global community to see what's to be expected. From policy circles, there's a lot of focus on the preparedness and response to it, including at the WHO level, a debate on coming to pandemic agreements. And this is then related to how to do monitoring and surveillance, how to share access to vaccines, how to share access to data and genome sharing, etc. That's much needed. My take on this is, and this is where Ron talks about, it's really about changing our consumption and production patterns, not only in the small Netherlands, but on an aggregate. We need to come to a kind of an agreement what kind of ecological space there still is to expand our economic activities. And the analysis of where these thresholds are overshot, where planetary capacity is being, Earth's system capacity is being harmed, is mainly in the industrialized countries. So there is, for me, an unavoidable, very uncomfortable discussion about reducing our energy output, reducing our material output, and also to see what is needed to regarding essential health services, what a sustainable food pattern, food diet could look like, and what in human behavior it seems that we are not willing to do it ourselves. So then the question is, when should governments intervene? Where does regulation comes in? And where do societies themselves already basically step in? And that's politics. politics within the Netherlands domestically, but also politics about the shared responsibility. Because even for pandemic preparedness and even for genomics and vaccine sharing, there needs to be finance. Are we willing to finance money into a public good? And that's a debate to be had over.
Right, thank you. Ama, just quickly, do you want to respond to anything that has been said by Ron or Remco?
Yes. So I also want to point out the fact that when we talk about climate change and its effects, we are seeing that happen across Africa as well when it comes to climate change on agricultural production. We've seen areas having a lot more droughts, so food security continues to be an issue. And we see the linkage between food security and deforestation, because what really happens is that as people want more farmlands, they have to go into the forest and get more farmlands. We get more contact with wildlife, and so we are exposed to more zoonotic diseases. So everything really is interrelated, and it's up to us as individual sectors, whether it's agricultural, environmental, or health, or even the wider economic sectors to start looking at how we can integrate and avoid some of these practices. So it's a big reality for us in Africa as well, and not just a problem in Europe. Thank you very much.
Right, thank you so much. And I can't resist to say that at Clingendael we have the so-called Planetary Security Initiative already for a number of years with a separate website, and that focuses really a lot on this link between environment and security as such. Mm-hmm. So how, in many places of the world, climate change already has impacts on instability and the competition over land and the relationship with food and water security, but also the spillover to health as an element in that. And I think the examples you give really also enrich my own expertise on that issue, and I find it super interesting to learn more about that. So thank you for pointing that out. Vera, I would like to go over to you because I see many questions are posted in the chat. Really pleased to see that.
Yes. Yes, we have a lot of questions. There is a question specifically from Henk Meijer, specifically addressed to Remco, which is on what are the expectations of the EU global health strategy to planetary health topics besides research programs?
Okay, thanks, Henk, for this question. It's a relevant one. So the expectations would be that health becomes more central in all policies of the European Union. For instance, looking at the impact of European policies in the trade or foreign policy or in the energy domain, and what that would mean for health as such. There's an EU New Green Deal, which has a lot to do with agro-farming reform, and to come to net zero in to come to net zero in 2050. What would that do for health? And also thinking through pathways and scenarios. Might there also be side effects or not? Because there's a lot of investments being taken to come to net zero, but it might lead to high energy prices, etc. But that also leads then to perhaps relative impoverishment and people not being able to access universal health coverage, etc. So these kind of effects, that's something I would hope that there's a mandate to look at these from a health and all policies perspective, and as such that it triggers a debate about what kind of growth we actually pursue within the European Union, because it's about sustainable and inclusive green growth. That's the way they call it. But from the planetary health analysis and the overshoot that we already have, I question whether that's possible and whether there should not be a debate about, okay, how can we come to economic well-being without pursuing this competitiveness agenda as we're doing now? At least not in the old way we have been doing it, which is just more and more economy and trade activities and globalization. And that's really a debate between sectors. And I think we as health professionals and scientists should have a much higher stake into this than we had before. We also need to understand how these the politics and how these other sectors function.
Right, thank you, Remco. And I think that's also part of the European Green Deal is also the farm to fork strategy, where they also had this idea to set aside indeed more land for nature purposes. But because of the food security crisis and the food prices, it was argued, well, maybe put it in the fridge because we need the agricultural land for food production. Countries like France and Romania and others lobbied very hard for that. But in the longer run, I guess that's still the development to go to. And also indeed the climate neutrality in 2050 objective is firmly enshrined also in the European climate law. What I'm more worried also about is also indeed the nature and biodiversity policy, because that has been so difficult to pursue. And also at the international level, Biodiversity Summit in Kunming was postponed again. So it's very tricky apparently to draw attention to this more abstract issue of biodiversity and species. And so yeah, I think that's one of the challenges. I would like to go back to Vera to see if there are other questions that you would like to pose.
Yes, we have a few more questions. There's one question posed by David Patterson. He did not specify to whom it is posed, so anyone who would like to join in. But it is talking about a disconnect between the scientific and activist communities on one side, that are calling for urgent action, and government sometimes on the other side. And one strategy for change is public interest litigation. So he cites the example of the Urgenda case in the Netherlands. And his question is, do the panelists consider a role for taking legal action in order to speed things up?
Ooh, that's a rather specific question. Is there potential for litigation in this field to address the don't look up issue? I guess that's a bit the issue that the science and the activists point out about the urgency of some of the issues. But then, let's say, the government and the general public also consider other interests and short-term interests of importance, and decide sometimes also even literally to look the other way. Is there somebody who's has a position on this, or is it just something that we should linger as a possibility, maybe to pick up in future events? Remco.
Yeah, maybe very shortly. There is at the moment no binding law that binds countries to have actions on the, let's say, on the aggregate level dealing with, let's say, specifically then coming to pandemic risk. That's why they are negotiating now an international law under the World Health Organization to hold countries accountable. But also that before that's being ratified and before that's becoming an international norm, it will take several years. So I do see perhaps the relevance, but I would be afraid that it will become a long juridical fight, while at the same time many other things needs to be required at the moment. It's simply also the law. It's not so clear as it is, for instance, through agreements like carbon neutrality by 2050 and the Paris Agreement, etc.
Yeah, and also the climate science is, of course, well established through the IPCC reports. I see that Tobias Rinke de Wit posts a link to Urgenda, which seems to suggest that something like this is already kind of being taken into consideration. Yeah, interesting development. Vera, I would like to go back to you.
Yes, there was also a special question from Henk Meijer specifically to Ron Fouchier. How can we, Netherlands and our EU, strengthen international access to epidemic and pandemic virus to optimize genomic data sharing?
The issue of data sharing on this issue. Yeah, how can we avoid countries keeping their own data or being secretive about it. And I even learned recently that some countries have laws that data should be stored in their own country, so not on internationally. And for some countries, I can imagine that, but for other countries, I was a bit more surprised. Let's put it like that. That being said, in the Netherlands, we are very much opposed to data centers, and we have a lot of trust in clouds being also hosted elsewhere. We are actually concerned about the data centers because they consume so much energy, and we think we already have so much pressure on the energy sources, and they take up so much of our space also. Ron, how do you look at the data sharing, data issue?
Yeah, this is a very, very important issue. I think Amma already referred to it earlier too. I think, of course, the Netherlands and Western countries should set the example right about how to share data in an equitable way. In the influenza community, there have been problems in the past with several countries that did not want to share genome sequences anymore because vaccines were being produced from those sequences and then sold at very high prices back to the countries that could not afford those vaccines, which is, of course, clearly not the way to do it. And so databases have been set up. The Gizet initiative is one such database where genome sequences can be shared, but where the countries remain ownership of the data and cannot be legally used to make vaccines without consent of the countries from which the genome sequences were derived. So that's one initiative that's ongoing, which was also used for COVID subsequently. And so hopefully that will set a new standard. At the same time, we have new legislation, international legislation through the Nagoya Protocol, which is really making things difficult in the infectious disease community, because the Nagoya Protocol is really about countries' right to their own biodiversity, including genome sequences, but of course, including viral or microbial genome sequences in that protocol restricts the sharing of viruses or microbial genomes globally, which also then restricts the health response to those outbreaks. And so clearly that Nagoya Protocol was not written with virus or microbial genome sharing in the mind, and should be adjusted. But of course, the fact that genome sequence sharing is now problematic because abuse of the sharing by countries that have the outbreak is something that should be broken, and that starts by no longer abusing the countries that share genome sequences. Mm-hmm. But one approach to that is already on the table. It's the Gizet initiative of genome sequences, which was launched for influenza, has been used for COVID, is now being used for monkeypox as well. And of course, that is a system still evolving, but it seems that most countries in the world are willing to put their genome sequences in that database, where they still retain ownership rights to the sequences, but bring global health to the next stage.
So this is called the Gizet Database.
That's right.
And this is based in, is it a multilateral initiative or is it a science-based initiative?
No, it's a multilateral initiative. It stands for Global Initiative for Sequencing, for Sharing Avian Influenza Sequences. That's how it started, but it evolved with countries like Indonesia, Thailand, Brazil, also into sharing other viruses. Many African countries are now sharing through Gizet as well. And so it's really an initiative from both the science and the governmental perspective, because it also in part deals with the Nagoya issues on sharing genome sequences.
Yeah. And the issues you mentioned in the relationship to the Nagoya Protocol, were they on the agenda? Were they supposed to be on the agenda in Kunming with the Biodiversity Summit, or is that a separate track? Do you
I
happen
think
to
this
know?
is a separate track largely because so there are countries who would like the Nagoya to indeed cover microbial genome sequences and viral genome sequences, and there are countries that don't like to see that happen. So there's still a disagreement on it. And it's not an easy issue to deal with. I know the World Health Organization is working on it. We have lawyers in the Netherlands that are experts in this topic by now, really trying to make this this genome sharing, virus genome sharing or microbial genome sharing possible in the interest of public health whenever, or animal health whenever that's needed, and at the same time to protect biodiversity of countries.
Yeah. Wow. So that's a whole world in the interface between health and biodiversity and data sharing. Ama, would you like to add something to this debate on the basis of your, let's say, the African perspective? I know that Africa is a huge continent with many countries, but would you like to add something to this debate?
Yeah, so I'll just pick up from where we left off with the sharing and the legal implications of sharing. And I realized that if we allow legalism to take its root, we will have countries closing their sharing of data, which is what we want to avoid as we go forward. I'm not sure how to balance this. Yes, we want to protect information that comes from countries, but we also want to encourage scientists across the world to share data. So the legal side will work, but I think what really matters is our investment in the regulatory systems, especially in Africa. We've been looking at that, having an African Medicines Agency that looks at the regulatory systems across the continent, and ensuring that our institutions can regulate the kind of information and data sharing issues across board. So we have some form of uniformity, and it's easier to engage with other continents when we have one voice. So that is something that we're working on, to have one agency that sets the regulatory systems across Africa. And we're hoping that that comes on board very soon. Many of the countries have ratified this in the African Union. And so very soon we'll see the operations coming on board, and then the regulatory system will pick up and we'll be able to engage in a more open manner across Africa and also across other countries. Again, please let's continue to build bridges instead of tearing ourselves apart, because the pandemic doesn't respect any border. We've seen it happen with COVID. Within seconds, everybody has an infection, whether you're far away in Europe or wherever you are in the world. So we really need to build bridges across our scientific community, and that should be done quickly. Thanks. Over.
Yeah, and also these scientific channels in the diplomatic world of international relations at Clingendael, we talk a lot about this science diplomacy, and I always have to think about the field of global health and also the provision that was already in the international health regulations that medical doctors, if they find a new disease, they can already report this directly to World Health Organization, but then World Health Organization has to go back to government authorities to check. And in one of the previous webinars, we also asked our, at that time, Minister for Development, Cooperation and Trade, Sigrid Kaag, with a huge UN experience, should we in the future have kind of weapon inspectors for health that go into countries and try to find the truth? Is that at all possible? And then it comes back to issues of sovereignty and also these economic interests, and also this interest of not closing borders. That are this balancing act in the pandemic instrument that is now also being discussed. Vera, other issues that are brought to the table?
Yes, one of the final questions I've received so far, which is bringing it back to Netherlands, a question from Beatrice Stickers. In the upcoming Dutch Global Health Strategy, which ministry should be accountable for bringing down the risks the Netherlands poses as a hotspot for zoonotic disease outbreaks? And where should progress towards targets be monitored and reported? That's her.
Yeah, wow. Yeah, wow. Beatrice, fantastic question. And she knows how difficult it is. Beatrice is one of the persons really behind also this webinar series and always super constructive in helping to find interesting topics, speakers, and so on and so forth. And also very much engaged with the development of this Dutch global health strategy. And that's one of the challenges, you know, is this an issue for development, for health, for agriculture? And of course, the answer is everybody should feel ownership and be involved, and health should be everywhere. But in the end of the day, you also have to make kind of a division of tasks and final responsibilities and ownership. So where would that be on this front? Any thoughts on that? And then I think we should also close for today. This is perhaps the most one of the most difficult questions. Remco, what are your thoughts on this? And please don't say everything and everybody. Huh?
No, I think in the request and where it's landed also in the budget of the government, it's now with the Ministry of Foreign Affairs in relation to development cooperation and how that's being financed. One moment.
Oh, I think Remco has something, so maybe we go first to Ron. Ron, what is your take on this question?
Well, I think the way it's arranged now is that as soon as there is a zoonosis in the Netherlands and outbreak in humans, then VWS takes over. So the Ministry
of Health
is the final responsible person when it comes to human health. Now, clearly, when these outbreaks start in animals, then it's the domain of the Ministry of Agriculture. And so the Ministry of Agriculture should do anything in their power, in my opinion, to prevent zoonotic infections to take on in domestic animals. So the Ministry of Agriculture should have a really good monitoring system and preventive system of viruses or other infections starting to spread in domestic animals. But the final responsibility for zoonotic infections and human health should remain with the Ministry of Health. And they will take, that's already arranged, they will take the responsibility as soon as zoonotic infections take over.
And who are the best placed to consider this at the international level, and how to deal with the relationship with third countries, in your view?
I think it's the same way. The FAO and World Organization of Animal Health should coordinate with countries to make sure that the that the domestic animals are healthy and kept healthy, that the animal health issues are okay. But when it switches to become a human health problem, then I think the responsibility should be taken over by the WHO. And I think that's also how it's coordinated there. But maybe one little step back is we talked about the fact that so little is happening at the governmental level. And that's why litigation is sometimes used now by the agenda for some of the longer term issues. One of the problems we're facing in our countries is that governments take seat for short periods of time, generally only 4 years, and are really not looking that well into the longer term strategies of climate or the environment, but also of pandemic preparation. So pandemic preparedness plans are really high on the priority list until 1 or 2 years after a pandemic, and then they disappear because most governments think that within their term, this problem will not arise, and so it is not high on their agenda for the short-term plans. And so I think that that's the only reason why litigation is sometimes used to make sure that, in fact, short-term governments act on longer-term problems. And so this is something that I think should be considered in the global health strategy, and how to enforce governments and governmental organizations, international organizations, to make long-term plans.
Yeah. Well, this is a general issue, and of course, I witnessed this and I recognize this to a large degree. In my view, in the European Union level, with the European Commission, this is slightly better, you know, the longer term viewpoints and the scenario exercises and the strategic issues are getting a little bit more of attention. So that's also perhaps where we can let's say find, you know, a basis for this. Remco, you were disturbed, please.
Yeah,
and you also wrote the advice of, you also contributed to the advice of the International Advisory Council on Foreign Affairs on global health. And I think they also, your commission also said something about this issue, please.
Yes, so it's a multi-sectoral approach. They give much more role for the Ministry of Health, International Affairs at the moment to coordinate it. But it comes back to what Ron says. It starts with government and political leadership commitment at the moment on this issue. So it's getting the attention in Parliament and government that this is something they need to invest in and take consideration for and have a long-term plan and not just short-term programmatic actions. That is what is at the moment what is needed. There are a lot of other priorities, but those priorities are connected. Climate change, the biodiversity part, the nitrogen farming debate, they have impact on health. So from a longer term public health perspective, this needs to remain on the political agenda. And only afterwards we can talk about where responsibilities lay within the Netherlands and international.
Yeah, all right, clear. Ama, do you have any viewpoints on that? How powerful are health ministries, agricultural ministries generally in Africa, or is it other departments or other agencies like this new African Medical Agency that you were talking about? It could take a role here.
So I think within nations in Africa, the Ministry of Health has a lot of responsibilities, especially with regards to public health. So for us, for example, in Ghana, the Ghana Health Service has a public health division that takes care of everything to do with pandemics and surveillance and all of that. We also have the Ministry of that all agricultural sector that looks at everything to do with zoonotic diseases and infections in animals. The issue here is how to engage these sectors and the environmental sector to work together. And that has been going on for quite a while. So mostly we want to build competences across the agencies so that they can actually work together. And that has been going on. We have our development partners, WHO, FAO, who supports these integrative measures. And we see that happen across Africa, where the different ministries are supported by external partners to engage together to help prevent some of these infections. Mm-hmm. Thank you. Over.
All right. Thank you so much. Thank you. I think we should round off. I just wanted to look at Vera. I noticed in the chat there is still a question about, you know, with the pandemic, wasn't it also our own human behavior? Of course, maybe we're not very different from animals sometimes, and that we know that there are rules, but yeah, we want to party also sometimes, or break the lockdown breaking efforts. Is there any burning last questions that the speakers can really answer in 1 minute, or should we close off, Vera? What's your opinion?
Oh, that was the last question we received, the one you just talked about.
Yeah. Okay. So I think maybe a personal question. Did you break any of the lockdown rules? No, I'm joking. Thank you so much. Thank you also, Vera, for monitoring the chat. Thank you to the participants for being so active in the chat, posing all these questions, participating in this webinar on the 7th of July. Thank you for the YouTube viewers. This webinar will also be available afterwards. So we hope that many people maybe in holiday destinations will listen to this as a podcast or view it on YouTube. But especially also thank you to Joris and Maha from Clingendael, who were doing the technical hosting of this webinar. And the biggest thank you to the speakers of today, Ama, Ron, and Remco. I really learned a lot today. and I thought it was super interesting to discuss this topic in one of the Global Health webinar series. And I hope also that we're going to continue these conversations and continue to follow it and see how they are evolving and taken up by the policy and political levels in the Netherlands and beyond. Thank you, and hope to see you back in October. Thank you also on behalf of the co-organizers, Coordate, KNCV, TBC and AIDS Fonds. In October, we hope to organize another webinar on the issue of health financing. So how can we make sure that all the things that we want to do in the field of health are also financed and in a sustainable way, so that it's going to be long-lasting and a structural improvement for peoples. Thank you and have a good summer for now. Bye-bye.
Bye. Thank you very much. Bye.